All right, this second question is gonna come from Jojo Jackson. I have a question, please. Why is it that you don't have epi in the injection, and in what circumstances do you need it? And what does buffering mean? Thank you very much. You're very kind to answer. Jojo, thank you for this question. This question is for everybody should know the answer to these questions. And actually the reason why I use lido and no epi is convenience. We want to make things simple and at the least variance as possible from provider to provider. So when we order a laceration tray, the standard order is lidocaine without epinephrine, because in few circumstances giving epinephrine might be contraindicated, potentially dangerous. So you rather use plain lidocaine on everybody. If you really want the epinephrine, then you ask for it individually. So what does epinephrine do? Epinephrine is a vasoconstrictor. It's going to compress those vessels. It's going to slow down bleeding. So when I'm doing things where they're bleeding a lot, I want that epinephrine to help me vasoconstrict, delays the bleeding, and I can kind of see what I'm doing better. It also increases the time of the medicine where it's gonna remain numb. So in other words, when you inject the medicine, the epinephrine vasoconstrict, it doesn't allow that lidocaine to go into the bloodstream and diffuse as much, so it's gonna last longer. For the ER purposes, once you're numb, you're gonna get done, they go home, they're gonna have some pain medicine, so it doesn't matter so much to me that they last 6 hours versus 4 hours when you don't use epinephrine. So that's just the convenience part of it. Reasons when you wouldn't want to use epinephrine is any distal circulation. Tip of the nose, the ears, because they don't have good perfusion. Here there's cartilage and stuff, and the cartilage gets their blood flows through diffusion. You don't want to use it under your digits, because if you compress the vessel by using epinephrine, then you might get a prolonged ischemic effect. You don't want to use it toes, fingers, and of course genitalia and things like that. So any distal area that's not going to get good blood flow from other places. Any central place like an arm, a forearm, even in the face over here, epinephrine's fine. And actually that's more of a theoretical risk of lack of circulation, because they've done plenty of studies when they inadvertently inject lido with epi to a finger, and they do just fine. Even when they get blue and discolored, it only lasts a few hours and it's just fine. There's always a reversal agent that you can use to inject it locally to revert that effect. So I wouldn't worry too much about that. Now, buffering is something that, honestly speaking, should be done all the time. Why wouldn't you buffer the lidocaine? Lidocaine is very acidic, and supposedly a lot of the pain of the injection is because the lidocaine is so acidic and it hurts as it gets injected. Again, it's gonna be convenience. The buffering for Bicar comes in big 20 cc vials, and you only use 1 cc to buffer 10 cc's of lidocaine, so you end up wasting all that buffering. Plus you have to mix it yourself, and the patient gets charged for it. For something you're going to inject a few cc's, I know patients want it, but it's not worth it. It takes too long. It doesn't really decrease the pain that much that it matters. Well, if it was you and you're going to get injected, sure you would want it. Currently, I'm working at my hospital getting the tiny little bufferings of lidocaine. They come in opening vials that are 1 cc. That would be perfect to get it buffered and then injected into the patient, because it will diminish the pain of the injection. But it doesn't come pre-buffered from pharmacy or pre-dispensed, because it affects the shelf life of the lidocaine, so it's no good to have it pre-done for you. So again, it's a convenience. It's just so much easier to have plain lidocaine, no epinephrine, no buffer, just get in and inject. Of course, if this is a big abscess, you have time for pharmacy to send you the right things. You want to use a buffer, you might want to use epinephrine on it. And the other question you might have also is, what is the difference between 0.5%, 1%, 2% lidocaine? So supposedly you're using more lidocaine per volume, so you think more lidocaine is better. And they've done studies that 2%, 1%, there's really not much difference in numbing when you use one or the other. Would you happen to use only less fluid into the injection site if you use 2%? Theoretically, Yes, but a lot of times the success of the lidocaine is because you injected and infiltrated and it found the right nerve. The more volume you have, the more chance it's going to diffuse over that area and numb that nerve. So if you only use 5 cc's, even if it's 2%, it might not reach the nerve you want it to do, and then you don't get numb. But if you have 1% lidocaine, you inject more chances more to diffuse and get to that nerve and numb it. So Jojo Jackson, I hope that answered your question. Thank you for commenting and posting that question. I hope this answered. If not, let me know and we'll get back to you.